How long is follow-up after kidney cancer treatment? Imagine finishing your treatment for kidney cancer and wondering what comes next. The answer is that follow-up care usually lasts at least 5 years, but it can go longer depending on your situation. After treatment, your healthcare team will want to keep a close eye on your health to catch any signs of cancer coming back early. Most recurrences happen within the first 3 years, which is why the first few years are the most closely monitored. However, some cases can show up even after 5 years, so long-term follow-up is important for your kidney health and overall well-being. Right after your treatment, follow-up usually begins about 6 weeks later. This initial visit helps your doctor see how you're recovering and review pathology results from your surgery or other treatments. The frequency of follow-up visits and imaging tests depends on your risk factors. If your tumor was small and caught early, your doctor might recommend imaging scans and check-ins every 12 to 20 for months for up to 5 years. For patients with higher risk features, such as larger tumors or aggressive cell types, visits might be scheduled every 3 to 6 months during the first few years. These visits often include imaging tests like CORT scans of your chest and abdomen to look for any signs of recurrence or spread of the cancer. Sometimes MRI or ultrasound might be used instead, depending on your specific case. As time goes on, after about 5 years, the frequency of follow-up can often be reduced. Some patients might transition to less frequent check-ins with their primary care provider. But it's important to remember that up to 10% of recurrences can happen later than 5 years, so ongoing monitoring may still be recommended in some cases. Long-term follow-up isn't just about catching cancer early. It also involves watching for late side effects from treatment and making sure your kidneys stay healthy. Your healthcare team might develop a survivorship care plan tailored to your needs, guiding you on how often to have checkups and what tests to get. In summary, follow-up after kidney cancer treatment is a multi-year process, typically lasting at least 5 years, with more frequent visits in the early years for those at higher risk. This careful monitoring helps detect any return of cancer early and supports your kidney health after treatment. Remember, each person's situation is unique, so always follow your healthcare provider's advice for your specific care plan. If you have concerns or questions about your follow-up schedule, be sure to discuss them with your doctor to get personalized guidance.